Hello friends and welcome back to my YouTube channel. So today's video is regarding anesthesia. So you might have heard this word anesthesia in medical. So it is the one of the modern medicine and the greatest advancement that making surgeries and medical procedures painless and safe. But the question that comes in our mind is, how does it work? And what should you expect if you are undergoing anesthesia, whether it's a routine procedure or a complex surgery. Anesthesia plays a critical role in ensuring comfort and safety. So in this video we will explore the different types of anesthesia. The word anesthesia is derived from the Greek meaning insensible or without feeling. Anesthesia is a cornerstone of modern medicine. It allowing patient to undergo surgeries and medical procedures without pain or distress. But what exactly is anesthesia? Anesthesia is a medical technique that used to block the sensation, awareness, or pain. It can be as mild as numbing a small area for a minor procedure or as deep as rendering a patient completely unconscious for major surgeries. There are mainly three types of anesthesia. You can see here local, general, and regional. So all of which affects the nervous system in some way and can be administered by using various methods or different medications. So anesthesia are the agent that bring about reversible loss of sensation. Alternative definition is reversible lack of awareness, including a total lack of awareness or lack of awareness of a part of the body, such as a spinal anesthetics. So anesthesiology, it is a branch of medicine. Nurses working in this area need to have knowledge and skill to care for the patient who is being given pre-medications under anesthesia and the recovery. So we should know the various roles of nursing when the patient is undergone the anesthesia. An anesthesiologist is also a very highly trained specialist who ensures anesthesia is administered safely. We will monitor his vital signs and adjusting medications as needed. Now we will see the another definitions according to the different authors. According to the Williams, it is the loss of feeling in all or part of body with or without loss of consciousness. The patient was given an injection before surgery. Next is the, according to the Lippincott, so it is the general loss of the sense of feeling as pain, heat, cold, touch, and other less common varieties of sensation. According to the Levis, it is a reversible blocking of pain feeling in whole body or in a part of it using pharmacological or other methods. Now we will see the different types of anesthesia. There are mainly four types of anesthesia: general anesthesia, regional anesthesia, local anesthesia, and dissociative anesthesia. So we will see one by one all these types of anesthesia. First one is the regional anesthesia. So in regional anesthesia, it affects a larger portion of the body by blocking nerve signals, and this include the spinal anesthesia and the epidural anesthesia. It often used for lower body surgeries and commonly used for giving during the childbirth, and patient may stay awake or receive sedation for relaxation. So here you can see this upper one is the epidural space. So the injection that goes into the epidural space, that is called the epidural anesthesia, and that one which is going to the spinal space, that is called the spinal anesthesia. So you can see the area is different in both of the anesthesias. Next is the local anesthesia. So local anesthesia It mainly inhibit the sensory perception within a specific location of the body, like tooth or urinary bladder. So it will anesthesia will numbs a small or specific part of the body. Like example, you can see if other than this, other examples are skin biopsy or stitches. So patient will remain fully awake, may feel, but patient will not feel any pain in the treated area. You can see here this image is showing local anesthesia, so patient will not have any pain. Next is the general anesthesia. So general anesthesia refers to the inhibition of sensory, motor or sympathetic nerve transmission at the level of the brain. So it results in unconsciousness. So there are three types of general anesthesia: spontaneous, controlled and assisted. So which type of anesthesia? Based on whether the patient will breathe himself under anesthesia, or patient need to be ventilated artificially, breath should be given to the patient, or patient can breathe himself but needs assistant during the surgery. So it can be induced a controlled or unconscious state where the patient feels nothing and have no memory of the procedure. It used for major surgeries like require careful monitoring of the vital signs throughout the operation. So there are one other type, that is the, here you can see general anesthesia, how this one is the inhalation. Then induction may be given through various techniques. First one is the injectable, so IV injections of the following medications can be given like thiopenton, methotrexate and hexobarbitone. And other inhalation agents like nitrous oxide, cyclopropane, halothane ether, trichloroethylene and ethyl chloride. Then the rectal installation is also, but this one is used in case of children. Then dissociative anesthesia. This type of anesthesia uses agents that inhibit the transmissions of nerve impulses between higher center of the brain, such as the cerebral cortex, and the lower centers, such as those found within the limbic system. So dissociative means the separate. So the if the patient will having any pain, so in that type of, so patient will get separated. He will not have any feeling of in that particular area if this type of anesthesia is given to the patient. So this is all about today's video. So anesthesia has transformed modern medicine, making surgery and medical procedures safer and more comfortable than ever before. So whether it's local, regional, general anesthesia, careful planning, expert monitoring ensure best possible experience for every patient. So this is today's video is just regarding the types of anesthesia. In our next videos, we will see regarding the how these anesthesias will work and what will be the roles and responsibility. So if you have ever any question or concern about anesthesia, don't hesitate to speak with your doctor or anesthesiologist. Because understanding the process can help you feel more confident and prepared. So thank you for watching. If you found this video helpful, be sure to like, share and subscribe for more medical insight.